Chula Radio Plus presents Chula Innovations Unlocked.
Parkinson's disease is a neurodegenerative disease commonly found in senior citizens. Statistics show that in 2010, there were about 60,000 people with Parkinson's disease in Thailand. During the past 10 years, the number has been on an upward trend, and today, 3% of the country's senior population have Parkinson's disease symptoms. That's approximately 360,000 people. This week on Chula Innovations Unlocked, we visit the Center of Excellence for Parkinson's Disease and Related Disorders, King Chulalongkorn Memorial Hospital, to talk to Assistant Professor Pathamon Panyakel and Assistant Professor Adjunct Onanong Pokyawarangkun, the doctors behind the success of the PDPlus application, which helps Parkinson's patients record their symptoms, remind them for medications, and offer games to report their performances in motor coordination for monitoring and diagnosis. Dr. Onanong, Dr. Pathamon, thank you so much for your time and welcome to the show. Of all the symptoms of patients of Parkinson's disease, which ones are most worrying for physicians?
According to the patient symptoms, I understand that most of our Parkinson's disease patients, they're quite concerned about the motor symptoms because mostly of the symptoms patients have, there could be either motor symptoms and non-motor symptoms. Right. But motor symptoms usually involving with the effect to the activities of daily living. So patients might have problem with the cannot move, barely moving themselves. Right. Problem might have the shaking a lot, or problem might have the stiffness over the body. Right. So in my opinion, the motor symptoms is quite very concerns for the patients and usually have a problem for the physicians to take care and adjust the medications to help them.
Right, but the symptoms of Parkinson's disease is not deadly, right?
Yeah, that's right.
Right, but it kind of bothers the daily routine of an individual.
But it depends on the patient as well, and depend on the severity of the patients. Right. Because in the patients with early stage of Parkinson's disease, sometimes the patients, like Dr. Onanong just says, so they have a problem with the hand movement because of the slowness of the movement, and then sometimes the patients cannot like write properly or use the hands to do some activities of daily living. Right. But in the later stage of the disease, the patients may affect the gait, the walking abilities, and the posture. So it depends on individual patients as well as the severity of patients.
I see. So walking would be a problem.
Yep. Right.
Driving would be a problem.
Right.
Cycling and all the motor activities.
Right. So this is a part of the motor, but like just Dr. Onanong just mentioned that there's also non-motor symptoms that the patients are concerned as well. Maybe the quality of the sleep and the sleep problem, like the dream enactment, like they have a bad dream at night and then they have like some movement at night and then sometimes kick the bed partner. So this is just one part of the non-motor, but you can then emphasize more.
Yeah.
I see.
And sometimes some of part of the motors can be occur since before the onset of the motor symptoms, because we just recently know that there are some non-motor symptoms that can be occur before the onset of the motor symptom or the onset of the diagnosis of the Parkinson's disease. Okay. Actually, currently we call this symptom as a prodromal symptom.
Right.
Prodromal.
Yeah, prodromal symptom. It means that the sum of the symptom that begins before the diagnosis of the Parkinson's disease. Because currently for the clinical diagnosis, currently we usually using if patient have the motor symptom. For example, patients has either bradykinesia or the slowness of movement. Okay. Patients have the shakings or the tremors. Right. Patients who have the stiffness of the bodies or the rigidity, or patients who have the problem with the posture and gait abnormality. We identify these kinds of patients who have the Parkinsonism and might be Parkinson's disease.
Okay, so you use that as like a checklist.
Yeah. We have a checklist for that can be indicated for diagnosis. But there are some symptoms that do not relevant to this kind of symptom that can be occur before, and currently we identify that these kind of symptoms can be like the trigger to the physicians that these kinds of patients probably might be the Parkinson's in the future.
Right. Okay. So this one, if everyone knows about it, maybe they have like a concern that they will have the Parkinson in the future. But I'm not afraid, dude. Make you afraid, but I mean you have to notice yourself. Not only the sleep problem, but severe constipations, also also the prodromal symptom as well as the non-motor symptom when the patients have Parkinson's disease as well.
Is it true that the symptoms of Parkinson's patients could change and vary throughout the day? And if so, why is that?
It depends on the stage of the patients as well, because at the very first stage, the very early stage, the patients may have some motor symptoms, and like I just mentioned, so maybe have just a disturb of the motor activities, like for example, the dexterity, how they use their hands to do the activities of daily living, but no others symptoms such as a gait problem or the balance problem. But when the disease progresses, so they have like more axial symptoms like the gait and more and the balance problem, and they will have like some gait problem and lead to fall. And then when the disease progresses, the response to the symptoms to the medication change as well. That's because of the loss of the cell in the brain that cause the less responsive to the medication. So in the doctor perspective, we have to increase the medications in order to make the patients has a normal symptom that they can do the activity of daily living. And after that, if the disease progress more, sometimes it need more medications to kick in into the on. We say on is mean that the patients can do activity as normally, but in the off symptom it means that the patients have more symptoms of Parkinson's disease such as shaking, slowness of movement, and a gait problem. So we need more symptoms to kick in, and then the durations of the on duration is less and less. It's shorter and shorter. So maybe we have to increase the medications schedule in order to make the patients feel normal throughout the day. And sometimes if the brain receptors and the receptor in the brain change due to the frequent medications, that can cause the movement, like more movement is called like a dancing. We call in the medical field as dyskinesia. There's motor symptoms can be fluctuate throughout the day like this, and sometimes at night as well. The patients can barely move during the night.
So how will the PDPlus application assist doctors and patients in fighting with Parkinson's disease, and how did this idea come about in the first place?
So as Dr. Pillman, she mentions about that some of the symptoms of Parkinson's disease quite be fluctuated over the day. So that's why this is quite be challenge for the physicians to identify which period that could be more fluctuate and which period that could be treated. Because sometimes you cannot treat everything at the same time. So you need to choose for some of the activity that could quite be very relevant or quite be helpful to improve patients' activity of daily living. So that's why in the initiations of the applications, we identify, for the first thing is to identify what time or the exact time of the day the patients have the symptoms. As you mentioned that most of the Parkinson's disease will be soon to have the motor fluctuation. This is quite be like the symptom that is quite be really resistant to the medication that usually occur to all Parkinson's disease people.
Which is quite common.
Yes, this is quite common. But by the way, at the beginning of the symptoms, usually patients can be well treated with the oral medications, but later, like maybe 3 to 5 years later, patients might have the fluctuation of the symptoms. So that's why the medications, they probably might not have the good functions as usual. And the doctor needs to increase more medication, need to adjust some medications. So that's why we realize that when or how that we can adjust the medication to properly with the patient's symptoms. But by the way, if you ask patient at the clinic, okay, how about your symptoms for the last 3 months? How about your symptoms at the last month?
Do you have
story? This is very long story. So it is quite be really unlikely for patients to understand all the symptoms, and this is unlikely for the caregiver to remember all the situations. We need something to help us to document for the patient's symptoms every day.
And how does this PDPlus application step in to help people with Parkinson's disease?
So the symptom fluctuate during the day, and sometimes the patients come to us and it looks normal. And I say, why? Sometimes the patients say that at home they're not well, and we say, no, you look good, right?
You look normal.
You look normal. But actually, because the symptom fluctuate, that's why we have to identify the worst symptoms of the day that the patients have, and then we would like to correct that time. And like Dr. Roman just mentioned, we have the appointment every 3 months. So sometimes we just say that, oh, the past 1 month, how about your symptom? So they just remember about it, but it might not refer to the past 2 or 3 months. Right.
Or even if they can, it wouldn't be as accurate.
Right.
Okay.
That's why we need an applications. Before the applications, we have the paper, the paper
Like a
diary.
diary,
The diary. So it's kind of like there's the time, the day, and the medications, and the time and the date, and then they have to check. Like this is on, this is off, or like more movement, or we call this kinesia.
Right.
And when the patients give the paper to us, it's like, oh, what is it? So we have to identify the problem from that paper, which is very difficult. That's why this come to the idea that if we use the smartphone and the patients can record the symptoms that vary throughout the day, and it can summarize to us like how many times, how many hours that the patient's in the on and what time, like maybe they are good at the morning time and worse in the evening, something like that. We can see the trend and the summary of their symptoms according to their perception.
And also it is a good thing of the applications because we have the parts of the examinations. Because currently we believe that when we use things, the most like the clinical evaluations in the office or using the scale, sometimes this could be not truly objective evaluations. But by the way, using the apps or using the games that we develop in our application, this is more correctly and also can be more objectively to evaluate the patients, even very minimum of the symptom change. This is much more correctly and very precise. For example, if I ask patients if the patients have the problem with the writings, with the drawing or something like that, but we cannot evaluate the symptoms correctly if I increase the medications to the patient and see how's going on after increasing medication. Sometimes this kind of the improvement could be very minimum. So that's why if I look at the paper, okay, how about your writing, this is good or not, I probably cannot identify this is improved. But if I use some applications, I could be noticed even very single or very minimum of improvement
the
of their
details.
Yes, the small details.
It's kind of like quantitative or objective testing.
And also I can do repetitively to evaluate the patients according to the days or the time that increasing the medications. So this is quite be very important that we can evaluate patients like regularly.
So the app has 2 parts. So the first part is the diary part. We just like change from the paper version into the applications. And actually this is the stimulations. This is not the real patients. We have the sections for the schedule of medications, and we display it into the color and the shape of the medicine and the time.
There's a
and you can
timeline.
see the time, and then because you can see that the patients sometimes like have to take the medications every 3 or 4 hours, and the number and the amount of the pills is different. So it's very hard to remember. So if we have this is kind of like the medical
guidance,
right? In
what
each
to
dose.
take, when to take, how much to take.
Right.
Okay.
And then if you feel right now, if you pretend that you are a patient and you feel that you're good, so you just tap it and you can see it's just like an emoji icon, and this is normal. Right, or maybe on. On is mean that you are on stage is mean that you are very good.
On is good.
And off is bad.
All right.
And also the third one is dyskinesis. Like I just mentioned, sometimes when we prescribe the medications and then it's a little bit above the level that this is on, the patient's gonna like have dyskinesia or dancing, and this can disturb as well, because sometimes if you like move all the time and then the patient will just say that what happened to you, something like that. So the patient sometimes doesn't like it, but some of the patients that it might be better than off symptom. When you record like every day in maybe in a week or in a month, it's gonna summarize into the graph, and then you can see like how many hours that you are in the on state, it's mean normal, how many hours you are in the off state, and the patients can assess themselves that how many hours and what time that they are often in the off or in the on stage, and then when they come to see the physicians, and then they're gonna say, so this is a summary of my symptoms during the past 3 months. Then we can also assess the compliance. It means that the patients, how many times the patients take the medications on time. if the patients take the medications on time, it's going to be good for the patients. But if a patient already take it on time but the symptoms still bad, we can still like adjust the medications, not just only okay you have to take it on time, something like that.
So that's the diary part. You mentioned about the games.
The games,
Yeah, it's
right.
the games.
Sounds
So you
fun.
want
Sounds
to-
fun already.
This seems to be like the additional parts of the PDPlus exams because this application is target for the patients to use at home,
Right.
and they send the information to the physicians. But by the way, we have the another applications of this PDPlus because we believe that if patients doing something like a test, most of patients don't like a test.
Of course.
They don't want to become
Sounds too serious.
Actually. So, but but if I ask patients to do some game for me.
All right, let's do it.
And sometimes they prefer to use the game every time that they come to see me. So I ask patients, okay, I would like you to play the game for me every time you come to see me.
Okay.
And patients feel very good
fun.
because this is fun and they didn't think that they have some problem or the disease that they need to test.
I see.
Yeah, so that's why. So I would like to show you for right now we have many of the tests that we can
Can we turn it
identify to
around?
the patients.
Okay.
So right now we have many of the games, or actually this is not all the game, but some of them have the games and also with intervention that we can do for the patients. But most of them seem to be like a game.
All right.
For the first thing is we ask the patients to do the selfie.
See, just take a selfie.
Take a selfie.
As simple as that.
Yeah,
All
it's
right.
really simple. But due to some of the Parkinson's disease patients, they have the problem. They have the difficulty to express the facial expression. And they look sad. They seem not to have the happy life, something like that. And we found that these kinds of face usually occur in Parkinson's disease patients.
Okay.
We have recruited all of the information and we have the collections of the photos of the people with our Parkinson's disease people.
Okay.
There are some of the study. They found that if you're using some artificial intelligence, there could be like a discriminations from the face between patients who have no Parkinson's disease and patients who have Parkinson's disease.
We've come to that level already.
Now we almost.
Okay,
We almost.
Not yet, but I mean, for physicians, sometimes when we see like the patients, I mean, coming, not before I know that the patients have Parkinson's disease. I know because of the facial expression.
Yes.
Okay.
Because sometimes the patients just wait in the waiting room, and then I just find, okay, this patient has Parkinson's.
But the reason that she can identify the patient because she is specialist. They believe that some of the doctor could not identify, or some other people could not identify as a specialist identify to the patient.
All
So
right.
if we have this information, that may be helpful
I see.
for the older doctors.
Can I
to
hit start?
Yeah,
All
sure.
right, so I'm just gonna take a selfie.
Okay,ค่ะ. So the first phase, I would like you to express yourself as a neutral.
Okay.
Neutral.
Neutral.
The neutral.
Yep. And take a selfie here and I guess.
All right.
Okay.
Yep.
Okay,
Joy.
ค่ะ. And then express yourself as joy.
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 Happy. Being
Yeah.
happy.
Right.
So apart from my neutral and joy faces, the application asks me to take a selfie of me being sad, angry, afraid, surprised, disgusted, and contempt. All of this information will then be evaluated by an artificial intelligence.
All right. Go. Okay.
Yes. So after you finish, you just go back. And the data we're uploading. As Dr. Patamon mentioned, that Parkinson's disease has many stages. So at the early onset of the Parkinson's disease, some patients have just minimum symptoms.
Okay.
Even with the fine movement, they could have some problems.
Okay.
So I would like you to do the tap fix.
Tap traffic.
Yeah, the tap traffic,
Okay.
yeah.
The tap traffic. Let's see
Yeah.
how that goes. All right.
This is very easy taps because I would like you to
Tap
tap
the
your
gray
finger.
area.
Tap the finger continuously because this is will record the numbers of the tapping.
Okay.
Fast as you can.
As fast as I could.
Okay.
All right. So start.
Yes.
3, 2,
2, 4, 1.
Oh.
Yeah, exactly.
Okay. So the countdown at the left side of the screen is now 9, 8, 7, 6. So people with Parkinson's would kind of tap a bit slower. Or?
Right.
Yeah, but mostly of the patients with early symptoms, some of them can tap fast as normal people. So that's why we use the another tap to help you because many Parkinson's disease patients they have the problem with alternating taps.
Ah.
Yeah, so that's like this time
Just one maybe.
one sometimes higher numbers than
Right.
normal people. So I would like you to do alternate taps.
Alternate tapping.
Yeah.
All right. Ready and go.
So this is very difficult for PD patients, Parkinson's disease patients to do it, and that's why sometimes the patients have, we call these dexterity abnormalities, and that's why this leads to hand functions abnormalities.
Okay.
Right.
So the next, I would like you to tap all the times, but once you see the red light, need to stop.
Okay.
But if you see the green light,
All
keep
right.
tapping.
This is like go no go.
Yeah, go
Right.
go.
All right. So, it's almost like.
Okay.
All right.
Okay, ค่ะ
Right, so this is a game for the hand
Yeah.
functions, and then actually for the patients who do that daily
Right.
can do this at the same time.
Yeah.
Okay.
But because sometimes the patient feels that they are on, but still they are, but actually they are not in the on state. But it depends on the perceptions.
So these games could be doctor's orders, or they could voluntarily do it.
Yeah, but mostly for the big tab, for the big tablets, usually we use in the clinics.
Right.
And to identify for the patients, checklist for the patients, we have almost for the all objective evaluations to the patient as
Right.
well.
Because I mean the one that usually asks the patients to do is the alternate finger tapping.
Okay, so there's like some line drawings, there's
Yeah.
tappings, and
Right.
all of this is
Yeah.
used for medical evaluation.
Yeah,
Right.
also if the patient has the Parkinson's disease patients,
Okay.
after we using these kinds of evaluations and follow up, patients have the improvement of the symptoms or decrease of the motor fluctuations or not. Yeah.
I see. So what is your next step of R&D?
These applications can be used to distinguish two categories, the
Okay.
Parkinson's disease from the diseases look like Parkinson's disease. In the patients with had very mild symptom, very with subtle symptoms, sometimes the patients cannot like feel that they have it, but we cannot test by the physical examinations.
Right.
And this can come to the national screening
Right.
project. Like, so maybe we can use these and then follow up. If they have like abnormalities, we can differentiate it. And maybe this is the golden period for give some treatment that
All right.
might prevent. But I'm not saying this we're gonna find it, but in the future,
All
if
right.
we can
Fingers
find
crossed.
Yeah.
right,
All right.
that find some medications that can protect or prevent the diseases, so
Right.
then this should be good.
In this moment of time, as we speak, can we cure Parkinson's disease?
Actually, we have no curative treatments for Parkinson's disease. Yes,
yeah.
yes, because the Parkinson's disease is one of the degenerations of the brain. So it's even some degeneration. So it could be treated curely.
Okay.
But by the way, currently most of the medications that we have right now can be treated very well. But mostly affect for the patient at early stage of the Parkinson's disease.
When asked if there's any way we can keep ourselves away from Parkinson's disease, the two experts' recommendations are 1. Exercise regularly, 2. Get enough quality sleep, and 3. Maintain a healthy diet. 2 thumbs up for Dr. Patapon and Dr. Onanong and all the staff at the Center of Excellence for Parkinson's Disease and Related Disorders, King Chulalongkorn Memorial Hospital. And that's all the time we have for this episode of Chula Innovations Unlocked. See you next time. สวัสดีครับ
Chula Innovations Unlocked is produced and presented by Superjohn Klinsawan. This program is brought to you by Chulalongkorn University.